so everyone can see what I'm going to be talking to. Okay, should be coming up for everyone now. Don't know if everyone can see that PowerPoint. Can everyone?
Yes, I can see that. I think that should be on people's screens.
You're on.
Yeah. Alrighty. Oh, well, again, I just wanted to say thanks very much for everyone coming along today, and also similar to the start of today, Martin, I want to also acknowledge the traditional owners of the land and pay respects to elders past, present and emerging, and also acknowledge the fellow panellists and also our keynote that have put a lot of time and energy into being a part of today also. As Martin said, I'm actually a venue support worker working out of Banyule Community Health with Gambles Help North and Northwest, and have been for the past 10 years. Previously, I worked for Crown Resorts, as Martin mentioned, as a responsible gambling liaison officer and dealing directly with intervention and assisting people that were showing signs of distress and unacceptable behaviour, and in particular referring people on to Gambles Help Services and other support services that people might need. I have actually been delivering the statewide program with colleagues of mine for those 10 years. As I said, there's over 20 of us that perform the role of venue support worker across the state, and we are heavily engaged with gaming venues in relation to training and being able to ensure that they're across the codes of conduct requirements, and also being able to ensure that they are able to provide assistance where appropriate with some of the harms that people are exposed to. Again, I just want to confirm, can everyone see this slide now with the statewide program coming up? Okay. I'm just going to put it on full screen. Okay. So talking about the statewide program, the venue support workers are actually engaged with the agencies the hospice agencies that provide the Gambles Help services, and be able to ensure that venues are participating in the responsible service of gaming training that has been in effect for our program since 2017. Very shortly, the refresher courses are going to be delivered by the venue support workers as well, to ensure that everyone's up to date with those particular elements that are now needed to occur. The other thing around the program is the level of venue engagement is very, very high. Venue support workers are in constant contact with venues and be able to provide relevant training and support, as I mentioned, but also just in relation to providing the information that they need to be across from outside agencies, depending on where their venue is located. The other type of things that we do is ensure that we're building capacity of staff in relation to their understanding of the responsible gambling codes of conduct and provision of the support services, because the staff are the missing link to being able to ensure that people are guided to support services like Gambles Help, for example. And that has been the goal of our program since its inception back in 2010, to ensure that they have the capacity to be able to provide referral to support, and also for themselves, obviously being at a high risk group, working at the coalface and in line with exposure to the gambling product. And that's also going back to what Luna was mentioning with the online, obviously being the topic of conversation in this current pandemic. We have been heavily involved again with CALD communities over the journey as well, previously with the Centre for Ethnicity and Health, and also with different groups similar to what we work with at Banyule Community Health, which is Arabic Welfare. We have had enriched partnerships with those communities, in particular the region that I work out of with Hume, which covers off Craigieburn, Roxburgh Park, and some of those spaces. And the type of training that's been conducted out in venues with Arabic Welfare, for example, is to ensure that people have an understanding as to where some of our friends from overseas have come from, the journey that they've been on, migrants and refugees, some of the grief and trauma that they've been exposed to, and being able to ensure that everyone is afforded the opportunity to be able to be providing provision of the support services that are relevant to their different cultural backgrounds. So that has been a very positive relationship. And again, with the foundation, there's the Chinese Peer Connection Program that some of you will be quite aware of. And previously when I worked for Gamble Southern for the first 6 years of this program, a lot of work done with the Vietnamese community, with Cantonese, Sudanese, and also with Indigenous communities coming out of St Kilda and Paran, Balaclava area. CALD in-venue training is delivered by venue support workers, again, venue-specific needs depending on what community groups are attending venues. So a lot of the training is, again, being able to get them to recognise some of the grief and trauma and some of those areas that I've spoken about just before. But in regards to just being able to have that high standard of customer care and customer service that they've subscribed to under their responsible gambling commitment message. The standardised training sessions that we've been delivering for the 10 years or so now, outside of the responsible service of gaming that we deliver, is based on being able to identify problematic behaviours and be able to ensure previously minimising the harm, and then also being able to now ensure that we're following guidance around behaviours, behaviour categories, and using some colours that have been researched to be able to ensure that they have an idea around the early warning signs and then more probable and high risk behaviours. So being able to identify, being able to then respond to those behaviours, and obviously being able to then refer appropriately to different support services. When I did the role of Charter Champions Officer when the sporting club programs sort of kicked off with the Responsible Gambling Foundation, a couple of key things that we worked on was having someone that's the go-to to be able to have a nominated person, somebody that's known as the responsible gambling officer within venues and outside of venues within sporting clubs and other community groups, is having that nominated person that is comfortable, has the confidence to be able to then be the signpost to those different support services and be able to refer people on. Not being a counsellor, not needing all those credentials that obviously are very, very important to actually then be the next step, but somebody that has the confidence to then be able to then provide the provision of support. So having those responsible gambling kits or packs, as we used to call them when I worked with the responsible gambling supports here at the casino. So there's some of the key elements around the standardised sessions. There's a number of sessions that we provide in relation to mental health, which I'm going to talk about shortly, in relation to alcohol and other drugs, self-exclusion programs, and also in relation to your play and how the machines, the myths, the facts, the play information display, just to name a few of those other additional standardised sessions that we provide. Obviously, being able to identify, respond and refer is a long and lengthy process, and it takes a bit of time to get through scenario training with staff. But again, it comes back to venue-specific needs around some of those different trainings that we provide. The importance of recording and reporting so that people are able to then keep a track of what's going on with behaviours in the venue, for example, is something that's also been an important part of our training sessions that we deliver. Venue connection, so being able to talk about some of the things that makes a venue work and being able to have a sense of community, because the entertainment destinations that people attend, there is a community within a community within a community, I used to describe, and it's very similar to where you all live. You've got your own little communities that you have, so you've got to think about that within the gaming space. You have your regulars, you have people that are coming from international locations, and local people from tradies, sparkies, to teachers, and the list goes on. So it's getting a sense of the different communities that do attend the entertainment destinations, and then the community of the actual venue staff and managers and people that actually have to connect with people that attend the destination. So it's all about the high standards of customer service and the high standards of customer care. So that's also within the Responsible Gambling Codes of Conduct that every single venue have adopted, and something that we've been training in particular over the past few years with our Responsible Service of Gaming Module 2. So getting that from the start and people having understanding that is critical to be able to ensure that you can then have provisional services and that connection is something that's really important. A lot of work being done on self-care, in particular the last couple of years, in particular the support of RSLs, in particular with a pilot that was run. So actually providing a standardised session around self-care to staff. So talking about keeping a diary, being able to look at other hobbies and things that will keep their mind active outside of the workplace, because shift work can be quite arduous and take its toll, but also that element of higher risk because they're at the cold base with that gambling product. So a lot of the time we talk about that. It's not just self-care necessarily for the individuals that work in the venue, but also for their families, their friends, their loved ones, and being able to then reach out to their own employee assistance programs as a first stop because they're all engaged with them. A lot of the time, we really do like to promote the fact that Gamblers Help can assist with any type of conversation, because you have therapeutic counsellors at the end of the line that can at least refer on to other support services. So there's never a case where somebody will be knocked back. A lot of the issues obviously stem from gambling-related harm, but we do cover a fair bit of content with self-care. The venue story. So we actually get to hear individual stories. So in relation to mental health issues, prior to the pandemic, being able to discover that people that are attending venues are actually experiencing PTSD, bipolar, schizophrenia, anxiety, depression, you know, the unfortunate views in particular with domestic violence, and some of those other cases, suicidality, self-harm, people coming to terms with grief, and all those other matters that are quite predominant in society. So having those venue stories then allows us to know how we can then facilitate next session of training, be able to then link them into appropriate other support. So that's something that's really important for us to touch on. Leading into the current state of affairs with the pandemic and the risks and impacts that are occurring, going back to some of the reasons as to why I was asked to present today, and that's talking about emerging mental health issues when gaming venues reopen. So currently, mental health, and as it was touched on by Luna, you know, a lot of people with this isolation, it's not doing them any favours with their mental health. And obviously when the gaming venues do reopen in due course, a lot of these things are going to come to a head when they present at venues, and for the staff to then be able to be equipped with how they're going to interact and provide relevant support. So some of the standardised sessions that are being developed include mental health as a session. So we cover that already, and it's going to be tweaked up into a more pandemic standardised session in relation to some of the impacts that this pandemic's had. We talk about different signs of distress, and all venue staff must be equipped with being able to be on the lookout for signs of distress, and that will then also lead into, in a lot of cases, unacceptable behaviour. So some of the issues that we have found with mental health training, again, some of those key ones around anxiety, depression, PTSD, is having link into the local Victoria Police members versus the Ambulance Victoria members, being able to talk to the relevant agencies that will be able to provide professional development sessions outside of the work that we do. Welfare officers within RSLs is another one that maybe people aren't familiar with, but there are welfare officers already employed within RSLs as another topic. We also do the sessions around drug and alcohol affected patrons. So a fair bit of content around hallucinogens, around depressants and stimulants and the effects of those, and also the fact that they mask and mirror intoxication. And so these venues have a licence to be able to operate, so they need to ensure that they're abiding by the VCGLR laws and also the licence requirements. So a lot of the time over the past 10 years or so, we've had a lot of venues that have issues, particularly around drug and alcohol affected patrons, which will again pose a great risk to when venues reopen. So that training is going to be critical to them to be able to ensure that they have protocols and policies in place to be able to deal with those sort of matters, and reference to help again. Special needs considerations, so people that do have some special needs in relation to equal opportunity and being able to return to venue, and ensuring that that's also at the forefront. So looking at all the access points and ensuring that people are going to be able to attend venues again with those considerations in play. It's really important, again, obviously with the restrictions and the type of protocols that will be addressed through COVID officers and those type of individuals that will have those responsibilities to be on the lookout for as well. So that's another area. The venues reopening, something that I've had conversations with my colleagues and with the foundation as well, is a lot of social skills have gone out the window as a result of isolation. It's almost like we're going to have to provide a session on how to have appropriate social skills again and being able to adapt to that, going back to screen time, which was mentioned earlier. For those that have got kids or even as adults that have just been invested in screen time, again, that's going to be a big topic to cover off on. But the venues and the staff obviously being isolated and not having employment at the moment, are going to have to be brushed up on some of those key things that make our spaces operate with the purpose that they're there for, and that's to have as entertainment. Professional development sessions, again, lining up with Victoria Police members, the local councils, council members, getting people from outside agencies, where a number of you have come from today, to come along and provide that to staff and to managers, is going to go a long way in ensuring that these times are going to be safer for people. We host those obviously through Gambling Harm Awareness Week, which is coming up soon, and also outside of that with our localised services, we run those as well. So that's another thing to be on the forefront. And the ongoing training and support that we obviously provide, as I've mentioned, is going to go a long way ensuring that when venues reopen and those mental health issues that are going to become prominent and already prominent, to be able to ensure that staff are aware of their roles and responsibilities when it comes to that. Some of the other key things, just in winding it up, there's additional support that I would like to also mention, and that is talking about mental health first aid. So for staff, managers to undertake that if they have the opportunity to have that done. The assist training, so in particular with self-harm, and being able to have those intervention skills as an option for them to also be across. And the venue-specific support and training. So if there's something that is occurring in venues that can be addressed from our level, and also including some other professional development that's at hand, then that will go a long way to making it a little bit easier on the staff and for the community members that attend the venue. There's one thing that I like to end on, and that is a lot of the time when we talk to staff, it's about the good, the bad, the ugly and the sad. So not everything's good for them, not everything's going to be necessarily working seamlessly for them. So we like to talk about the good, the bad, the ugly and the sad. So having that in consideration with the topics that I've covered off, that should help with a little bit about what we get up to outside this meeting today. And I'd again just like to acknowledge Louise Crowe from City, who was unfortunately unable to present today due to some family matters, and hope that I've been able to do the job well enough for her today. And I'd also like to again say thank you to Martin and everyone for having me along.